welcome back to my channel. It's been a while since I did a YouTube update. I know. There's been some messages here on YouTube as well as on Instagram asking for updates about certain things. I also did a kind of Q&A thing which I planned to do here, and then I actually, once I shot the video, I just couldn't stand looking at myself, so I deleted it, and then I just went back and did a live Q&A on Instagram. So I know I am saying this all the time, but if you have questions or if you want to see how things are going, you are better off going to Instagram, because I just don't YouTube anymore. So I know in some of my older videos that I had the handle at @LaBelleMama, but it was confusing because people who didn't know me as @LaBelleMama before were searching for D Doherty. So I'm pretty sure I'm D Doherty Carol on Instagram now, or maybe D Doherty, but you'll find me, I'll recognize my visage in the picture. So that's where you can have the chance. So this is an update video. This is a year after chemo and a year after surgery. It was just, today is Sunday. On Thursday, it was 1 year to the day since my surgery. Honestly, I hadn't thought about it being a year later until just yesterday, when someone said to me, I was about to say, when I was in the gym, and if you've been following me on Instagram, yesterday was literally my second time in my life ever being in a gym. Like, I've just joined the gym, so I'm dropping it into conversation as much as possible. When I was at the gym, someone said to me, so anyway, someone said to me in a nondescript place, oh yeah, isn't it mad, the weather's so different now to what it was this time last year. And I was kind of like, it's June now, and what was the weather like last year? And I actually just said, what was the weather like last year? And he said, it was like a heat wave, it was a week of amazing weather. And I said, oh yeah, that was when I had my surgery, I was in hospital. And he was like, oh, sorry. And I was like, yeah, I didn't enjoy that at all. And anyone who came in and spoke about how nice the weather was in big trouble. So that's how I remembered that it was a year ago. And when I actually thought about it, I was like, oh, actually, like literally almost to the day. So I guess what I'm gonna do is just talk about, you know, what life is like a year down the line. Now, it's not a year since the radiotherapy yet. That finished like end of October sometime anyway. But that as well was delayed, so really it all should have finished up much quicker than it did, but you know, I spoke about that before. So here's what's going on. I went back to work in November. If you remember, I did speak about that in a previous video, but if you didn't see that, I started a new job. It was like I work in childcare, so I was in a creche. I was a preschool teacher in the mornings as well in that creche. Loved it. It was a great way to get back to work. Was able to kind of ease myself into it. Basically, I've made some more changes. I now have a new job, which is in the company that I used to work for. Oh, you can hear my kids being super loud. It's the company I used to work for before I was sick, and I am delighted, so happy. Yeah, so here's the first thing about that. The fact that I started a new job to begin with, like in November, and then the fact that when I started to feel things are just not right for me anymore, for one reason or another, I decided to look for a new job. And I just know that life before cancer, BC, so D, BC, would never have done these things. You know, I was so anxious and so worried about, oh, what if, and what if it doesn't work out, and what if it was a mistake, and that kind of thing. Really would work myself up about that kind of thing. So I just know I would never have done those things. And now I just trust myself a lot more, and I do things to make myself happy, basically. You know, I won't allow myself to be in a position where I feel like I'm stuck in a rut, or I think this is not right for me, this is not doing something good for me. If I think that I'm gonna be unhappy in a situation, then I don't do it, you know, and I make a change. And yeah, that sounds really like I'm saying, aren't I brilliant? But it's such an important lesson to have learned, is to just believe in yourself, trust your instincts, and just do it, because life is too short. Okay, next, hair wise, I keep cutting my hair, obviously, and keep shaving the sides. It's just what I'm doing. I'm not gonna get into it now, but I've got super curly hair, and it's not chemo curls. They're not gonna grow out, they're there forever. So I just don't have the time to be dealing with it. So I'm doing my own thing, doing it my own way. Hashtag D's hair growth on Instagram. That'll show you all of the hair updates. Health-wise, okay. I have been well. I was unwell in March. I think it was March. Basically what happened was, what did happen? I don't know, I just started, I had a kind of a flu or something. I actually don't really remember how it started. I was in work, and I said one day that I really actually feel very unwell, so if possible, could I go home early? As the day went on, I was just getting more and more sore in my chest, deep within my chest, but then on the outside as well. So I was lying in the bed, and I think Noel came home from work then, and I was really like, you know, I was screaming out in pain every time that I moved. So, you know, if I was trying to roll over, I was just going, ah, like really, really dramatic, you know. And I think that he was kind of like, would you cop onto yourself? What are you doing? I'm so foggy on the timeline of it. Noel's in work, so I can't actually ask him right now. But I said, I don't want to go to a doctor because I think I'm going to end up in A&E, and I didn't want to go to the emergency department. Basically, I avoid hospitals at all costs now, obviously, and in particular the emergency department. Anyway, long story short, I ended up going into the emergency department in the Beacon, which is a private hospital here. And the other thing was that the outside of my skin, like over the chest area, was hot and red. So I was in there, they did a few tests, they did some blood tests and stuff, and then came back to me and said that they needed to keep me overnight. And that was unexpected. I didn't think that they would keep me. I really thought they would just give me some sort of like injection to not feel pain, and then some antibiotics or something. But anyway, I ended up being in isolation as well. So poor Noel had to wear like the gown up and mask and everything to come into me because of the influenza. The red and hot thing was cellulitis in the tissue in my skin. My ribs and the tissue between my ribs was inflamed and infected, and I had a really severe lung infection. Like, I won't say pneumonia, it was some kind of pleuritic infection, but my lung collapsed as well. So like I had to do that, you know, that blower thing with the balls to like get your lung capacity back, and nebulizers and stuff like that. So there's a whole bunch of stuff that just happened like that, okay? And what that is when I ignore the first signs of something and allow myself to just get too run down. So lesson was learned there. Mums do that all the time. I'm sure that, you know, dads do it too, but like in particular, I think it's a mum thing that you just power through, you just keep going, and you think, oh, the weekend will be here soon and I can chill out and go to sleep then, you know? So yeah, that's what happened there. Also, I was struggling with fatigue at that time as well, and perhaps should have tried to deal with that earlier. No fatigue now, really, I don't think. There's sometimes I get the odd day now and then where I just feel floored, like, and I think, oh, I must be coming down with something or something like that. But you know, I know that I need to go for a nap or something, so set the kids up with a movie and just snooze. On Thursday had a hospital appointment. So a year after, I really didn't notice that at all, to be honest, that it had been a year. Oh, that was lightning. Did you see that? Anyway, so went in to see plastics because last video I said this to you as well, pain. So much pain. I was thinking for a while, am I not able to cope with things as well as other patients? Because, you know, I as I said, it was in my mind, unacceptable level of pain to be in a year after the surgery, even like 6 months after surgery, to just be in constant pain all the time. That's just, I mean, that doesn't sound right to me, you know? And I am not talking about like, oh, a little niggle or something like that. Like some days it would be excruciating, you know? Like really, really sore, to the point of that not really being able to use this arm as much because, wow, it's bucketing down right now. Sorry, I'm so easily distracted. The result of that meeting with plastics on Thursday was that I do have the capsular contracture. To be honest, I feel like it was only a matter of time. The way they talk about how common that is feels like it happens to nearly everyone, you know? So yeah, seemingly the radiation and then the fact that I got the cellulitis is why, wow, I think it's hailstone. Okay, that's why I have the capsular contracture.
It's hailing as well, not just raining.
Yeah, I know. It's a whole other story, but there's a 3-year waiting list for the surgery to correct that. But I think I'm gonna probably do it privately at some stage, not too soon, because I am enjoying not being a patient and not having to recover from things right now. So I've learned to live with, you know, the uncomfortableness of this. And it's one of those things that now that I know what it is, why I have the pain, it seems to be a lot more acceptable, you know, it's fine kind of thing. So yeah, more on that at some other time, I think. I did do that Q&A, but a lot of the questions and stuff were around, you know, your mental health. How do you feel after cancer, kind of thing, you know, like how is life, those kind of things. So I suppose what I'll say is mental health doing quite well, you know, still feel grateful for the journey that I have been on. You see, like, this is, I get really teary about it because I am grateful. Like, I feel really lucky to feel the way that I do now, you know? I think I was trapped in my life before cancer. I was trapped in my own head and I was just stupid, you know? So, yeah. So now I do feel happy, genuinely happy. Like, if you see me with a smile on my face now, it's just because, you know, I'm smiling because I'm happy, you know? Are you ever not afraid of cancer coming back anymore? That was kind of what people were saying. And I remember during chemo and stuff, I was terrified of the thought. I thought, how will I ever get over this? How will I ever stop thinking cancer is going to come back for me? Or is cancer back? Is cancer here now? You know, if you get a pain in your leg, is that cancer? You know, or, you know, your back hurts, is there cancer in my spine? Something like that, you know, and those are very real fears, obviously, once you have had cancer in particular. But I mean, it's not stupid to feel that way, even, I was gonna say before you had cancer, not before you had cancer, but if you never had cancer, you know, it's okay to be afraid of these things. The answer is no, that fear doesn't ever go away, but you just learn to push it back further in your mind, you know. I do think that I haven't seen the last of cancer, you know. I mean, that's not just something that I've decided. I mean, that's speaking with my doctors. That's why I think that my anti-hormonal, like, chemo treatment that I take and stuff like that's been extended for the 10 years and everything. Like, I know that I'm a high risk of recurrence, you know, so there's that. But at the same time, like, as I said earlier, I'm enjoying not being a patient. I'm enjoying getting to live my life and be a normal member of society. So I don't really want to dwell on it too much because I want it to be a long time away. If it's coming back, I don't want it to be anytime soon. So I just try not to think about it or worry about it. I have gone for an ultrasound because I found some lumps on the other side, but that was fine. That ultrasound was fine. It was just sort of normal hormonal changes. And those hormonal changes were obviously because of the hormone treatment that I'm taking, you know, because I was kind of like, well, I don't have periods and I have no estrogen, so what hormonal changes are you talking about? And then there was an explanation for it. Once it makes sense, I'm like, okay, yeah, that's fine. Yeah, no problem. I found some lumps here on this side, but it seems to be kind of knots of maybe scar tissue or something. They're kind of like, literally feel like little beads under the skin. And then obviously, like, the lumps and hardening and everything over here is because of the contracture. So any worries that I have had it checked out. So obviously, if you are worried, then don't dwell on it. Just go to the doctor and get yourself sorted. And obviously, if you have been a cancer patient, you'll be seen a lot quicker, you know, because you're a higher risk than, you know, your average Joe. So yeah, you know, I didn't really plan what I was going to say here today, so it was a bit just chatty, but it's just an update. That's all. As I said, Instagram's the place. If you have questions or whatever, that's where you will find me, and I'll get back to you as quick as I can there. But yeah, I don't use Facebook. I do respond to comments here as much as I can, and you know, like, that's fine, but I don't make regular videos here anymore, so if you're waiting on one, it'll be a while, you know? Thank you very much for watching. I'll see you in the next one in about 6 months' time. Bye!